Hi guys, wanted to update you again. Some people had reached out to ask me what was going on, and I realized I haven't updated in a while. So the whirlwind of information and doctor's appointments and everything continues. But to sum it up, basically my recovery from the lumpectomy was fairly easy. I got the drain out on Thursday of last week, which was, 6 days after surgery. And I was so nervous about it. And it was so ridiculous. I told Tim, I'm like, I'm more nervous about coming in and have this drain removed from my armpit than I was going into my first chemo. I mean, honest to God, I don't know why. I think because it was just still tender in my armpit. I was nervous about what's it going to be like pulling this thing that's inside my body out in an area that's already very tender. But I felt nothing. So that was a lot of me getting myself worked up for basically no reason at all. Typical me. So that was done. And all of the liquid stitches, bandage, whatever it is, has now come off of the scars on where they took the sentinel lymph nodes out. The hole where the drain tube was inserted, they had actually sutured the tube, they kind of made like a little, this is what chemo brain, like what cut, incision, I don't know, like an X, and then sutured it to that. That healed up within like 24 hours. So I was really impressed at how quick that healed. The only thing that the liquid bandage, whatever, is still on is where he cut for the actual lumpectomy. So it's just still slightly tender, but nothing really bad as far as pain is concerned. So I can sleep on that side now. I could sleep on my stomach if I wanted to. It's all, I'm pleasantly surprised at how easy the recovery from that was. So if you're looking towards a lumpectomy and you're wondering, really not that bad. So that was the end of last week. Earlier this week, I met with my oncologist, and she told me that when she looked over the pathology report, because I asked her, I'm like, they told Tim for sure that there was no cancer found in the 5 sentinel lymph nodes that he removed, but we didn't really get a clear answer if that tumor was there or not. So she looked back over his report, and she's like, the way I read it is that tumor was gone. She's like, so we gave you the perfect amount of chemo, which was awesome. Yes? Hang on, babes. So that was really good. And she said that so the tumor was basically gone. And what was there still was something called non-invasive breast cancer. And she said that she's going to have them stain the pathology again to see what type of cancer that was, which kind of blew my mind because she was all excited at the results. And then when I hear that there was still some cancer or a different cancer in there that I didn't know about, that sent up red flags. But I guess what she said is this is a type of cancer that the tumor I had was invasive cancer, DCIS, I think it is the initials, ductal sarcoma in situ. And that was the tumor, and that's what I could feel. She's like, this other cancer that was in there is not spread. It's just, it shows up as spots on a mammogram. And she's like, you might not have never known that was there because at your age, you're not regularly getting mammograms. So, radiation is my next step. I meet with, and that should take care of whatever's left. Hey, excuse me, Missy. That should take care of whatever's left. And then so I meet with the radiation oncologist. Hey, you're wiggling this. Please stop. On Tuesday of next week to talk about what that plan is going to look like. So I'll update you then. Wednesday, I have an echocardiogram scheduled again because they're going to get a new baseline because I start my infusions up again a week from this Monday, I believe. Now, it's not going to be any chemo infusions. Those 2 chemos that I was getting, those are done. What I am going to continue are the 2 targeted therapy infusions because I'm HER2 positive cancer. And the way that works is since my cancer was not growing due to hormones, estrogen or progesterone, they can't give me hormone therapy. My cancer was growing due to a protein marker malfunction in my body. So the infusions that I will continue, Herceptin and possibly the other one, Perjeta, she's still waiting to hear back from the tumor board what we're going to do. That puts the antibodies in my body to stop my breast cells from overexpressing, creating tumors. So I'm going to continue that. It's probably going to go every 3 weeks through next summer, and every 3 months then I'll continue to get my echoes, because the Herceptin is the drug that was so taxing on my heart. So they need to continually monitor that. So that's my plan. I got 3 doctor's visits lined up for next week. One on Monday with the breast surgeon, Tuesday with the radiology oncologist, Wednesday is my echo, and then that following Monday I start my infusions every 3 weeks again, and possibly radiation. I don't know. We'll see what happens Tuesday. So Tim and I were kind of looking forward to things getting back to normal in our life, but it's still a steady stream of doctor's visits. I know every 3 weeks, and then for I'm assuming between 6 to 8 weeks every day, I'm going to have radiation. But again, I'll find out more on Tuesday. So I'm feeling awesome. I feel a lot more like my normal self. A lot of my energy is returned. My hair is growing back. As you can see, you can actually see my natural hairline here. My tastes are back. I don't have, a lot of the fatigue and the taste change that came with the chemo. Those have kind of gone, so that's awesome. So I'm feeling pretty good. I just wanted to update you guys on what was happening since last week. I know I forgot to update, and keep y'all in the loop. So thank you for thinking about me. I still appreciate it. Still need the prayers. Still appreciate them. I still know that they are being sent up and they're working. So keep it all up. And I will get back to everybody soon. Bye. You say bye?